1, go.
Take 2, welcome. We are collectively thinking about the best way to impart information about minors' consent in the law for paramedics in New Zealand. We have Stuart, Amanda, Hugo, and Kate. Can you help us think about the big issues that you encounter with children and consent? Hugo.
Well, I think some of the problems centre around the ambiguity in New Zealand law. What constitutes a competent patient? For example, we have a 5-year-old child. I think it's very subjective if you think they can understand the information, are aware of the implications of them either receiving treatment or not treatment, but their parents may disagree. And then I think it'd be helpful to have more guidance under the law as to what paramedics either can or shouldn't do.
What about you, Stu?
I agree. I think one of the other big things is where also guardians or parents come into it, and where they're allowed to advocate or not advocate for their child. So, a 16-year-old patient, female or male, are they able to kind of tell us what they want, or does the parents have the right to say this is what's happening?
Great. And in your experience, what's the best way to impart this information?
I think some of it stems right back to the education, paramedics having a good grounding in the law, full understanding, and then to have some discussion as a group in terms of what's the best course of action.
And how might we better educate sort of the public around, like families and parents, to sort of better understand what in what situations are they able to consent, and what situations is the child able to?
I think some of it is also about having a conversation at the scene and understanding that the paramedic is always going to be trying to do the best thing for the patient, and you can't come in with a hammer and say this is what is happening. You've got to kind of actually work with the family, with the patient, and so forth, to get the patient's needs met.
And I think there's also a wider possibility of educating the public in terms of healthcare, in terms of what's appropriate and what's not.
20 seconds.
Great. If you had one message to send to undergraduate paramedic students about the law, what would it be? 5 seconds, 5 seconds.
I think
3 seconds.
Fully understand the Health and Disability Act.
Always acting in the best interest of your patient.
Thank you.
Thank you.
We thank you.
Okay.
Everyone on time, that's great.